Amy from Canada underwent the veneer design simulation at the Oaks Dental Clinic with Dr. Chalmin Bae. The Oaks Dental Clinic is one of the rare dentists in the world which can actually design your new smile with you so you have full control over your look. This video will take you through the veneer design process and show you how it is done. Oaks Dental Clinic is located right at Gangnam Station Exit 12. You come into the A-Tower building, go up to the 7th floor and fill in the registration form which is written in English for international patients. You then have an initial consultation with one of our staff and go over your current dental situation and how you would like to improve your smile. The next step is to head to the X-ray room where you will undergo one or multiple X-rays depending on your needs. The Oaks Dental Clinic has the most advanced dental X-rays in the world, which include a CT scanner, panoramic X-ray, and even a handheld deep X-ray for hard-to-see spots in your gums. The X-rays are completely safe and are included in the price if you get treatment. The images will be sent electronically to computer screens at your chair. Dr. Chalmin Bae will then go over basic information with you and examine your mouth to see what kind of veneers you qualify for. There are two kinds of veneers which are considered the gold standard: prepped and non-prepped veneers. Non-prepped veneers are meant for people with large gaps and undersized teeth. They require minimal or no tooth reduction. However, these veneers are not suitable for most cases. The majority of people will need prepped veneers, which require the original tooth structure to be shaven down in order to fit the veneers properly. We recommend getting porcelain veneers for best long-term results. There are other veneer materials such as resin, but they are made of weak materials which will chip easily and turn dark quickly. In many cases we see, resin veneers don't even last 1 year before they change color or chip. Porcelain veneers last on average 12 years, but could last more or less depending on your dental health. After the initial check by the doctor is done and you have heard your options, you can explain what style of veneers you want, including color, size, shape, etc. All this information will be gathered, photos taken, and your mouth scanned into the computer system for analysis. Normally, dentists take molds and send them off to external labs in order to get the design and construction of the veneers. This delays the veneer process and causes it to become a 1 to 2 week ordeal, without any input from the patient during the veneer design. Because Oaks Dental Clinic has their own in-house laboratory, veneers can be made in as little as 1 day. Before we continue, make sure you check out soulguidemedical.com for more information. Contact us through the site or email us at soulguidemedical@gmail.com. With Amy's photos and dental images scanned into the computer simulation system, the design process can begin. Some sections of the design process have been fast-forwarded, as the full design can take up to 30 minutes to complete. The lab technician outlines the teeth which are visible in the smile line. Next, her full teeth photos are adjusted for shape. You can see the shape changes as the technician checks the design. The colors are chosen by the patient. Most North American patients tend to prefer a white shade which is whiter than the natural tooth color you're born with. They tend to prefer the Hollywood smile look. European and other patients prefer a more natural white, close to the A2 shade, which is the natural shade you're born with. The A2 shade is ivory white. Amy's design is the Hollywood smile with a very white color shade. Here you can see the lab technician checking the whitening and the shape of the veneers against the original teeth. Amy has 8 upper visible teeth in her smile line. In most cases, you should get at least as many veneers as teeth show up in your visible smile line. If you don't, your results won't be as good as you expect because you will have beautiful looking teeth with veneers next to imperfect original ones. Of course, it is up to you, but we highly recommend you take the doctor's advice when it comes to veneers. Oaks Dental Clinic will honestly tell you the minimum number of veneers you will need to achieve the best long-term results. The lab technician will then superimpose your full teeth image over the visible smile line to make sure that the veneers don't cause any functional problems. When getting a smile makeover, it is equally important to produce a functional design which will stand the test of time. The next step is to go through the teeth one by one to make sure that all mathematical proportions are accurate and suit the patient's facial dimensions. Because you are right there with the technician, you are guaranteed to get exactly what you want. This is the main complaint with normal clinics. The patient tells the doctor exactly what they want and then prays that the clinic's idea and their idea match. There is no real-time input from the patient. Instead, molds are sent off to external labs. If you don't like the results, you will usually have to pay for the veneers to be made again. With this real-time design system, you get exactly what you want, save time and money. This is why the Oaks Dental Clinic can produce veneers in as little as one visit. They have their own in-house lab, technicians, and design the veneers with you through the simulation system to produce the veneers that you want. The Oaks Dental Clinic can produce a single veneer, including the design process, in under 60 minutes. However, if you have lots of teeth to do, then it is better to give yourself 2 or 3 days. If you think you have gum or tooth problems, which need to be fixed first, we recommend giving yourself 6 to 7 working days to have the Oaks fix your mouth problems and then do the veneers. Veneers need to be placed on qualifying teeth. If your teeth are too badly damaged, you may require a crown instead of a veneer. The crown will be designed in the same way, but it caps the entire tooth structure, meaning more of the original enamel has to be removed. Veneers are actually a more conservative treatment than crowns. In some cases, a midway point between a crown and a veneer may be created. Every patient is different, and we will personally customize a treatment plan for your specific needs.
So, I'm pretty impressed with the computer screening of my new teeth. I think it would be amazing if you come to the Oaks Dental Clinic and get a whole new Hollywood smile.
If you are interested in plastic surgery, vision correction, skin treatments, dental, or other medical procedures in Korea, email us at seoulguidemedical@gmail.com. If you liked our video, share it, subscribe, and as always, thank you for watching.